How many sets per exercise? So generally, I'll do 4 to 5 working sets per exercise. I don't do a crazy amount of exercises in the gym when I'm training. Say if I'm doing chest, it'll be 3 to 4 exercises. Back will probably be about 4 exercises. So you're looking at bigger muscle groups. You're looking at 20 sets maximum. Like I said, 4 different exercises. But for me, I just find I really want to hit that muscle. Generally, I'll train in hypertrophy, 8 to 12 reps. But the majority of the exercises, like I said, I'll probably do for most body parts. I'll do 3 to 4 exercises, and it'll be 4 to 5 working sets. What's better, a bro split but destroying the muscle to failure each session, or push pull legs? By bro split, I guess you mean in split training. It basically comes down to anyone's preference, which you prefer. I have always done split training. I like to really focus on a large muscle and hit it from every angle and destroy it. That's always been how I train. If I'm doing shoulders, chest, triceps, then for me, how can I come in and smash my shoulders and have nothing in the tank wise, and then go and hit my chest? You're not hitting your chest at your very best. So me split train all the way. Push pull legs became the big fashion all of a sudden not so long ago, where you had to do push pull legs to grow and get big. But like I said, it's effective, and I do it for plans people, mainly if they're only getting in 3 times a week or so. But yeah, it's down to preference. The key is working the muscle, putting the maximum amount of stress on the muscle for growth. Views on standard block periodization. For me, it's vital for a progressive training plan. It will stop your body adapting to what you're doing week in, week out in the gym. It will maximize your results, and it will help prevent injury also. It's a great way for athletes to ensure that you peak in time for a competition. For me, generally, all my training plans will switch from on a cycle of strength, hypertrophy, and volume. We also play around with intensity, and time and attention for me is something that I like to play with. So yeah, for me, we're always changing what we're doing in the gym for myself and my clients. It's 100%. It's key for helping to progress your plan. What do I drink during a workout? So as most people know, I'm a big carb guy, and I'll generally drink carb drink during my training. Normally it's Vitago. I like to shuttle carbs during my workout, especially in the off season when I'm trying to grow and pack on as much size as possible. So yeah, normally Vitago, maybe dextrose or a combination of the two. If I'm dieting, getting ready for the show, it might just be BCAs or water. Nice and simple. But yeah, always drink something when I train. How do you defeat a gains goblin? So a gains goblin is very easy to spot in the gym. They're usually bicep curling in the squat rack. They wear gloves on leg day, and they normally wear one of those weightlifting belts on when they're training arms. The key to it is you never make eye contact with a gains goblin ever, but there is a way to defeat them, and that is you say a prayer to our Lord Father, Ronnie Coleman. You throw some lifting chalk in their face, and you yell at them, "Lightweight baby," and they will evaporate into thin air. So that is how you defeat a Gaines Goblin. True story. What can I take for gynecomastia? So this has come up a few times lately. The thing is, you need to stop that in a very early stage to be able to take anything. There are some AIs out there that will obviously stop that straight away. Problem is, sometimes it can let that go and it can develop onto severe gynecomastia. Unfortunately, there's no antiestrogen that can get rid of that. If it's gone too far, then it's going to be need to be something like surgery to remove the glands and to take away any excess tissue. Unfortunately, at that stage, anti-estrogen is there to prevent gynecomastia. It can't reverse once it's occurred. But yeah, letrozole is a very good thing to take to stop any problems in the chest early. I have seen it, helps, mild cases make it look better. But generally, yeah, if it's severe, then unfortunately, yeah, surgery is only going to be the only way to resolve that for you.